I'm joined by Dr. Isaac Mezzo, a neurologist with the Morris Hospital Neurology Specialist, along with Dr. Peter Analytis, Dr. Samuel Quainer, and nurse practitioner Stephanie Henline. Neurologists specialize in the diagnosis and treatment of disorders that affect the brain, spinal cord, and nerves. Morris Hospital Neurology Specialists see patients in Morris and Shanahan. I guess we're discovering that there are some lingering neurological symptoms from people who've dealt with the COVID-19 virus. Tell us about that.
Yeah, we have found that up to 40% of people who contracted COVID experience some sort of neurologic sequela. We're all familiar with the loss of taste and smell that follows the infection, but a lot of patients experience headaches, brain fog, which is actually the inability to concentrate and focus on a particular task. They also experience fatigue, cognitive decline, and a not very well-known prominent symptom known as COVID psychosis. This is where people begin to have personality changes, anxiety, paranoia, and overall they're not themselves, and it can lead to hallucinations and delusions, hence the name psychosis. And this is a very dangerous condition that requires immediate attention.
All right. Well, what causes these symptoms, and who's most at risk with them?
Well, it's not very well known for sure what the specific culprit is, but there's two possibilities. One, it may be the virus itself infiltrating the brain, or two, it may be related to an immune response, a very robust response that causes physiological changes in the brain. Interestingly, some patients have had MRIs of the brain, and doctors have found white matter changes, particularly in the frontal lobes and the temporal lobes. And we know that these areas of the brain tend to be responsible for behavior, memory, and cognition. So who's at risk for these symptoms? That's the million-dollar question. Presently, there are no data that have found a correlation between any known risk factor and the development of neurologic sequela from COVID.
All right. Well, how are the symptoms being treated?
Well, there's no specific treatment for all the symptoms. We use a multidisciplinary approach to treat each individual symptom. First and foremost, we tackle comorbid conditions, such as pre-existing obstructive sleep apnea and depression. We institute lifestyle modification, encouraging good sleep, healthy eating. When it comes to medications, we may use antidepressants, we may use stimulants, medications for headaches and migraine. And when appropriate, we refer patients for cognitive therapy, or we may refer them for counseling. For COVID psychosis specifically, close and vigilant monitoring by family members is most important.
Sure, well, we've learned that locally.
Of course.
Yeah, and when should a person or loved one seek help from these post-COVID neurological symptoms?
When it comes to mental health and COVID-related psychosis, the answer is immediately. There's no time to waste when it comes to the dangers that can come with mental health. On the other hand, we know that a lot of people will experience headaches, fatigue after COVID infection. So for the most part, these symptoms will go away on their own. However, many times they linger and make it difficult to get back to everyday life. For that reason, Dr. Quainer, Stephanie Henline, myself, we offer appointments at our Neuro-COVID clinic for patients who still have residual symptoms.
All right. Very good. Well, Dr. Mezzo, thanks for spending some time with us this morning. I certainly appreciate it.
Thank you for having me, Kevin.
To schedule an appointment with Dr. Mezzo or request more information about Morris Hospital Neurology Specialists, go to morrishospital.org/neurology or call 815-942-4506 or 815-467-0555.